Declan isn't feeling well. Lately, he's been having headaches, experiencing chest pain, and struggling to fall asleep. He decides to book a doctor's appointment. Naturally, doctors begin to assess him. Some recommend painkillers, perhaps an x-ray to rule out something serious, and one even prescribes heart medication after noticing his increased heart rate. After several visits, Declan starts to fall into a routine. He describes his symptoms, and the doctors search for a cure, something, anything to make the pain go away. But the pain and its symptoms don't go away. In Declan's case, and in many others, pain doesn't have a physical source. The symptoms he's experiencing, the racing heart, the constant ache in his head, the restless nights, may be signs of something deeper. Declan is suffering from depression and anxiety, and he's had suicidal thoughts. But here's the problem. Very often, mental health conditions are missed by healthcare providers. In many cases, doctors treat what they can see, but Declan's wounds, they're invisible. It's easy to assume that most people don't experience these conditions. Statistically, in the United States, 23% of adults experienced a mental health illness in the past year, equivalent to nearly 60 million, and approximately 280 million people in the world have depression, a 3.8% of the population. But those who do suffer are no less deserving of proper care. In fact, they are among the most vulnerable, and their needs often go unseen, unheard, and untreated. Declan's story is not just his own. It represents millions of Americans whose mental health conditions are either misdiagnosed or ignored. These invisible scars are symptoms of a larger public health issue, one that requires system-wide change. It's more than misdiagnoses. It's about barriers to care, like stigma, limited access to mental health professionals, and financial challenges. Declan is a powerful reminder that treating symptoms isn't enough. This is where public health steps in, preventing problems before they occur and understanding how factors like access to care, social support, economic stability, and community resources shape mental health outcomes. Public health policies can strengthen mental health screenings, fund prevention programs, and ensure resources reach those in need. These people could be sitting next to you, your classmate, your community member, or even you. So, how could Declan have been better treated? Imagine if he had access to community-based mental health services. Imagine if his primary care visits included mental health screenings. Imagine if behavioral health had been integrated into his care from the start. Those changes could have made all the difference. Because public health doesn't just treat individuals, it protects populations, it builds resilient communities, and it creates environments where mental health is recognized, supported, and allowed to thrive.